Okay, Mr. Usamali, tell me about yourself, please. Hello.
No.
Please tell me about yourself.
Well, my name is Usama Ali. I'm 26 years old. I studied matriculation from a local school here. Then I did my pre-engineering from a college, Punjab College, Kotli. After that, I did a diploma as a safety officer. Then I did a job as a safety officer for a couple of months. Then I joined an hospital. I worked there as a caregiver for the last 4 years. I was working there and I took care of many patients. I am very reliable. I have good communication skills. I am very patient person, and I think I am a best person, a best fit for my job.
Okay. So why do you want to be a caregiver? And why do you want to work in care section?
Well, actually, my father has been sick. My father had an accident when I was quite young, when I was almost 14, 15 years, and he was completely on bed. I took care of him, and I saw how miserable he was. He lost his eyesight, broken ribs, a couple of other fractures, and then I had to take care of him. And I liked it a lot. I like I also like helping people in community, and when I see old people, sick people, I like to help them. That's why I chose this, and I have some experience too from very early age. That's why I decided to be a caregiver. It makes me happy to see helping people, to making people happy.
Okay. So what is safeguarding?
Safeguarding means protecting someone from harm who is at the risk of harm and cannot protect themselves. Like some people have dementia or some other disabilities, and people can easily abuse them, and they do not have the ability to protect themselves. And protecting these people is called safeguarding.
Okay. So what is confidentiality?
Confidentiality means keeping private, keeping someone's information. If you are working in an organization, or if you are working with some person, you keep his information private. You don't share it to anyone unless it is very necessary or it is very critical to share. It's confidentiality, keeping someone's information safe and not sharing with anyone.
Okay. So what do you mean by abuse? And what is the definition of abuse?
Abuse means harming someone.
Okay. Can you tell me
Abusing
types
means
of abuses?
there are different types of abuse like organizational abuse, uh, hello?
Are you hearing me?
Yes,
Okay. So I think you're troubling with network.
I don't know.
Yeah.
It looks fine here. I don't
Okay.
know.
But I think it seemed that you are troubling with network. Okay. So tell me what is financial abuse?
Financial abuse means using someone's like using someone's credit card or using someone's money is financial abuse. Like don't not letting the person use his money or his will to spend money on him, like using someone's money that has been given to him care, for his care, using his is financial abuse.
Okay. So, what do you think about physical and institutional abuse?
Well, physical abuse is by harming someone physically, like kicking someone, pulling his hair, hitting, slapping someone is physical abuse. Domestic abuse also comes in physical abuse. And institutional abuse is when in a care, whether it's a carer or some his manager or the owner who is not providing the basic facilities to the resident or patient, is institutional abuse, also not providing the people with the medicines on time, not taking care of them, not giving them their needs, not providing them food on the time is also institutional abuse.
Okay.
Not letting the people.
Yeah, okay, okay. I think your network bandwidth is low because it's warning here. Usamali's network bandwidth is low. Okay, so no problem. What are the whistle blowing?
Whistleblowing is sharing inside information for raising public concerns, like if you see something unethical or illegal happening in an organization and share it with authorities is whistleblowing.
Okay, when you should be a whistleblower.
Well, we should, if we some, if we see something is going on, that's
Okay, do you know what is CQC and what the full form of it? Hello, are you hearing me?
colleague, we must share it with our senior staff. If it is senior staff, we must share it with the manager. And if it is the manager, then we must share it with CQC.
Okay,
So we must find evidence, which we must collect the proofs, and then we should submit it to the right person.
okay. So, do you have any personal experience?
Yes, like I already told you, I have experience taking care of my father, and also I had worked for the last 4 years in an hospital as a caregiver, giving patients medicines on time, taking care of them like their bathing needs, shaving, providing them food on time, and checking their blood pressures as well, giving them medicines, etc.
Okay, that's fine. What is mental capacity?
Mental capacity is the capacity of a person who can take decisions of their own. There's also an act, Mental Capacity Act 2015, which covers all these things. If a person can take his decision on himself, then the Mental Capacity Act gives him the liberty to take his own decision. And if a person who doesn't have that mental capacity, a carer or a care home takes the decision for that person, the right decisions to, and also take the help of that person to by the means possible.
Okay, so what is dementia? Do you know about dementia? What is it?
Dementia is a mental disability if a person like neurological disorder, like a person cannot use his brain properly to take some decisions. Like they are afraid of afraid to take decisions. There are other illness too that mental illnesses that come in dementia.
Okay, so what is person-centered care?
Person-centered care means taking care of a particular person, considering his will into account, what he wants to wear, what he wants to eat, how whatever he wants to do, showing empathy towards towards the patient and helping him all the with all the possible resources that you have is person-centered care.
Okay, so do you have any teamwork experience?
Yes, I do have teamwork experience. During the Corona time of pandemic, uh, we worked as teams because we were outnumbered. It was a lot of patients coming to our hospital, and we had to work on two, three patients at a time. It was very busy time, and I have a lot of experience as a team player.
Okay. So are you a good team player?
Yes, I guess I am a good team player because I am very patient. I try to read the people, try to listen to them. I'm very empathetic, and I am also very observant. I see what is happening around me and what I need to do and how I need to cope with the situation.
Okay. So can you elaborate me empathy of a carer?
Empathy of a carer means showing your feelings like you really care for that person. You feel his pain and you are trying to help as much as you can. Even if the patient is angry and if he's saying something, some rude things, I will not take it personally and I would try to help. I would try to follow the procedure that is being given to me by the care home and try to feel the pain of that person.
So what is personal care?
Personal care means it related to the personal person's personal things like shaving, what he like wearing, what he likes to wear. If a person wants to sleep more, we will allow him because it's his personal choice. It's and also bad thing helping the person do the daily needs is also personal care.
Why do you want to come to UK for this job?
Well, for the betterment of my future, there are a lot of job opportunities. They need a lot of care workers. I'm working here as a care worker too, but I think the government there provides a lot of benefits. They give a lot of benefits, and for better future, I think I should go there.
Okay, so do you have any experience that you worked under pressure?
Can you repeat, please?
Do you have any experience that you have worked as under pressure?
Yes. During the times of pandemic, a lot of people were coming, and we didn't know in the beginning. We didn't know what's happening around us, and we were outnumbered too. We had to see a lot of patients at a time. At that time, I was very scared about my health and the safety of our life, and also the other people around me. I think it was quite um, difficult situation.
Okay. So why we should not share our client or our patient residence information to others? Why?
Well, first of all, it is unethical. It is not good manners, not a good etiquette to share someone's personal or private information, and it is also illegal. Private,
Okay.
we must keep it confidential on, unless it is necessary for the authorities, local authorities, or police. We should not share it because it is unethical and illegal too. We must protect persons' confidentiality.
So how do you maintain dignity and respect?
I maintain dignity and respect by keeping personal, but by keeping the personal space. I let the people choose what they want to wear. I do not interfere in people's personal life, personal matters. I keep all the information personal and safe. I do not share it. If even I see something, I don't share it with my colleagues or other people. And I maintain my distance. I let the people choose what they want.
Okay. So how do you report with new residents? Report.
Yes, I rapport with new residents by being friendly. I have good communication skills, and I'm quite friendly. My cheery attitude is also well suited for my job, and I try to learn about their customs and about their religion, and I try to be friend with them and try to help them as much as I can. With so we create an environment where we share things and live positively.
Okay. So if any of your residents behaving roughly, if you see that, what you will do in this situation?
Well, I always try to be patient, and I would like to see if he has any kind of problem, if he is mentally disturbed, and if it is his habit, like he likes to do it, then I will try to report it and try to talk to the seniors about his bad attitude. But first, I would like to know the reasons. If I can help him, I would love to help him.
Okay. What are the duties that enjoy you as a caregiver?
Well, the most of them, important of them is helping others. I love to help others, and my parents all taught me always be positive and help others. That is the purpose of my life. And when I see smile on people's faces, especially the old ones and the sick people, it makes me happy.
So imagine that your resident has an accident or getting a heart attack. So getting heart attack. So while you're with them, what you will do?
I would try to be, if it is very serious, I would try to press the buzzer, and if I'm outside the house, I will call ambulance. Then I would try to see what I can do. If it is necessary, I will perform an CPR on a person. And if it is not that serious, like if someone has an injury and it is not bleeding that much, I would do the first aid. I will do the bandages and check that person is okay or not. And if it is serious, I will call ambulance.
Okay. Are you comfortable working flexible hours?
Yes, I'm very comfortable working except Friday, because Friday we have to pray, go for pray, and I must take a day off. And the other rest of the week, I am free. I can do flexible hours. I'm used to working from 8 a.m. to 10 p.m., almost 14-hour shift. So I think I'm flexible to work any hours provided.
So can you tell me what qualities make a good caregiver?
I think good communication skills. If you do not have good communication skills, you cannot see, you cannot feel, you cannot share your feelings with the patient. Empathy is also important. If you don't feel the pain of the patient, you are not helping him at all. And other skills, I think, patient. If you must be patient.
Okay. So what would you do if you see that after completing a shift, your colleague or another replacement has not been arrived here? What you will do in this situation?
Well, I would try to talk to the management, and if there is some emergency and I am available, then I would try to take over his shift and help the patient, and also the help the care home. And I would try to be helpful as much as I can.
So do you know what is emergency first aid and how do you use it? Do you know about these things? How?
Yes, I know about emergency. There is always a place in a care home or wherever you are working. There is always a place for emergency kits and fire extinguishers, etc. and I know how to use it. Like there are bandages in it, fire extinguishers as also theirs, and some other stuff like medicines.
Okay. So previous question that I did ask you, I could not hear you previous on previous question. So I'm going to ask you this question again. So what's the meaning of abuse? And tell me two mandatory or two uh, important abuse that related to your work.
Abuse means harming someone, a misuse of your power, anything is abuse. And there are different types of abuses like institutional abuse, institutional organizational abuse, physical abuse, domestic abuse. In institutional abuse, it means the institution, the other people not providing proper care to the people, not giving them their basic needs. Uh, and Physical abuse is by slapping someone, pulling hair, hitting someone, harming someone. Misuse of the medicines is also physical abuse.
So do you have any negative side about you, or do you have any positive side? Please discuss both.
Well, I think I have a lot of positives in me. I like to, I am very patient. I have good communication skills. I am very observant and reliable person as a caregiver. And as negative, I think I have do not have that much experience being a caregiver. I think 3 or 4 years or 5 years is not enough. And with time I will, and I think the language barrier would be, maybe it could be a negative for me for in the beginning. And with time I think I will learn it.
So what is CQC stand for? Do you know what is CQC stand for?
CQC, Care Quality Commission.
CQC stand for what? Stand for what?
CQC stands for Care Quality Commission. It is a commission in UK that regulates the care, the quality of care in care homes in UK.
Okay, fine, Mr. Osamali. You have finished your session, your interview, and you will be get an email within maybe 7 days. So
Okay.
the session is going to be end, and see you again, inshallah.
Okay.